Tonight, it's going to be the peak hospitalization, peak ICU week, and unfortunately, peak death week.
With the United States facing what could be the critical moment in the coronavirus pandemic, a look at how it's impacting different parts of the country. Plus, the latest breakdown of how the economy is faring in the face of the virus. And
I would have preferred the whole thing be done by mail.
Election 2020. Wisconsin's primary sending voters to the polls amid fears of COVID-19. All this and more tonight on Faith Nation. More than 1,200 deaths in 24 hours. America settling in for what could be the worst week of the coronavirus pandemic. Welcome to Faith Nation. I'm John Jessup. Well, tonight, healthcare workers on the front lines now as we hit some of the hardest days since the outbreak started in the United States. But even as the number of those killed by COVID-19 rises, some states could be on the brink of flattening the number of cases. CBN White House correspondent Ben Kennedy joins us with the details. Ben, deaths are increasing, but the news is not all somber.
Yeah, John, you're right. Surgeon General Jerome Adams, that is, sees reason for hope after warning this week could be like 9/11 or Pearl Harbor. And as you were talking about at the top of the show, some states like Washington, California, New York, and even New Jersey, they're starting to see the curve flatten.
A lot of pain again today for many New Yorkers, and they're in our thoughts and prayers.
But with that pain comes hope. New York Governor Andrew Cuomo saying the number of daily deaths from COVID-19 has been effectively flat, adding that the three-day average of virus deaths is also down, suggesting that social distancing measures are working.
It still depends on what we do, and what we do will affect those numbers. This is not an act of God that we're looking at. It's an act of what society actually does.
This week, the U.S. death toll surpassed 10,000.
Every one of these patients who comes in needs oxygen. Some of them need ventilation. We had to put 14 patients on ventilators in a 12-hour period just yesterday.
Dr. Anthony Fauci says the country won't get back to normal until there is a safe and effective vaccine. President Trump still supporting the use of hydroxychloroquine, an anti-malaria drug which is in clinical trials but not yet fully approved to treat the disease.
We've had some unbelievable results, and it also gives the people hope.
Officials warn of easing on social distancing in cities that may have passed their apex in an effort to keep new cases down. New York City Mayor Bill de Blasio says they are now fighting the virus's impact on the job front and projects 500,000 will be unemployed.
Now, the Senate is looking to Thursday to approve a $250 billion relief package aimed at small businesses, help avoid some of these layoffs that we've been seeing early on this week. Churches and nonprofits can take part in the relief. John?
All right, thank you, Ben Kennedy. ABC News Chief Medical Correspondent Dr. Jennifer Ashton is here now for more. Dr. Ashton, thanks for being with us. We've heard many experts warn this is a key peak week. What should Americans be expecting?
Well, I think that when you hear predictions about peaks or plateaus, we have to understand that those are based on models. They are only as good as the data being put into those models, and they're predictions. So they're fraught with uncertainty, but they're the best we have right now. And I think when you hear a peak is coming, the psychological response is to respond with a little bit of fear and concern, of course, which is appropriate. I think the behavioral response has to be to continue the aggressive social distancing measures that have been put in place pretty much throughout the country right now, because we need to understand that what we see today or in 5 days or a week really reflects something that was or was not done 2, 3, and 4 weeks in the past. So that time lag is really, really important. That's why when we finally do hear that we're past a peak, if you will, depending on where you are in the country, it's important not to just rip the Band-Aid off and go running out and resume our life as it used to be, because that will just result in those numbers going right back up again.
That real-time lag is a critical factor. The CDC director now predicts a lower death toll because of social distancing. We're also seeing the death rate slow in places like New York and Washington State. Does that mean these measures are working?
Well, absolutely they work, or we wouldn't be doing them, and we've seen it work in other parts of the world as well. To be clear, South Korea, China, they flattened their curve very quickly because of extremely aggressive social distancing measures in conjunction with very aggressive testing measures, which we have lagged somewhat with. So I think that when we look ahead, we have to incorporate both of those things to move out of where we are right now and back gradually into something that's done strategically and partially and slowly, and understand that what we do not only has a direct medical effect on ourselves, but on those around us. And that is really important when you're dealing with a public health crisis like this.
Dr. Ashton, about the push to get people to wear masks, how much will that help in prevention? And can you offer any tips on how to properly wear a face covering?
Well, you know, the mask issue has been so interesting because in the past, in medicine and science, we have used two different types of masks for two different purposes. The N95 respirators are used to keep viral particles out, and they are reserved just for healthcare workers and first responders. Then you have the surgical masks, which we use on sick people to keep viral particles in to prevent the sick person from spreading them into the environment. And now we have this third category of do it at home or DIY cloth face shield, so to speak. And I think that the purpose of that, which people need to understand, is not for the person wearing it, it's for you and the people around me. So we all need to do our part to try to slow the spread of this and protect others, and understand that as many as 1 in 4 people who are infected with COVID-19 show no symptoms at all. So they might feel totally fine and spread the virus without even knowing it, just by coughing or breathing or laughing or talking to someone who could get potentially very sick. So I think that's the point. And the second part of your question, which I love to get, is you want it to actually cover your nose and mouth. I see a lot of people wearing it up to here. That's not going to do it. So it actually has to come up, you know, about that high.
President Trump has advocated using hydroxychloroquine because of some cases in which the drug was prescribed to treat the virus and the patient recovered or saw dramatic improvements. I'd like to get you to weigh in. Can you explain how you weigh the benefits against the risks from a medical perspective?
You know, we're hearing a lot about this drug hydroxychloroquine that is starting to be used in clinical trials under an emergency use authorization approval from the FDA. This is a drug that is used to treat rheumatoid arthritis, lupus, and also as an anti-malaria medication. Its use and efficacy and safety in the setting of patients who are sick with COVID-19 is just now being studied. And in medicine and science, we always have to weigh benefits versus risks versus options and alternatives. In general, it's an old, cheap, and pretty safe medication. And in some small studies out of China and France, it does seem to show some promise, and it's always important to have hope in medicine and science. But we still need to understand the right dosing, the right timing, and really study it against the standard of care, which is just supportive care or traditional therapies in patients who are sick with COVID-19, before we can make a broad recommendation that everyone take it. And we also have to put it into context. There are a lot of medications that are being studied as possible therapies for COVID-19. Hydroxychloroquine is just one of them. And we do need to remember that it does come with a rare but potentially serious cardiac side effect of an irregular heartbeat, and that it is used for people with rheumatoid arthritis and lupus who need the medication. So absolutely, patients should not just run out, try to get it, and self-medicate. They should only do so under the guidance and recommendation of a physician or healthcare provider.
ABC's Dr. Jen Ashton, thank you so much for being with us today.
Thanks for having me.
To the economy, Wall Street today saw slight losses at its close. That after markets across the globe climbed. The Dow Jones Industrial Average ended the day down about 26 points. The S&P down about 4 points. For more on the economy, we now turn to Stephen Moore of the Heritage Foundation. Stephen, you said the United States could face the next Great Depression. What do you see as the tipping point?
Well, that's a great question. And you know, I just listened to the doctor and her fascinating analysis, and she talked about weighing costs and benefits. And that's what we have to do in any good policy, is weigh the costs of the decisions we're making versus the benefits. And in this case, what I was saying when I said we could face a second Great Depression is that if we continue to keep our economy in the lockdown mode that it is in now for another couple of months, we are not going to get out of this. There will be economic catastrophic effects. None of us want to see that. In fact, you could even argue that with a massive reduction in the size and prosperity of our economy, you'll see a lot of deaths and suicides and alcohol abuse and other kinds of mortality that's related to a bad economy and high unemployment. And so what I think there's a consensus emerging, at least among conservatives and free market people, that we need to stick to this May 1st deadline, if at all possible, that President Trump has been talking about. And in areas where it's safe and using the best medical practices, including the things that the doctor was just talking about, getting some businesses up and running. You know, we have about half our economy is operating right now. I've spent the last week or two talking to people who run trucking firms, people who run divisions at Google, and people run divisions at FedEx, which is, you know, has 350,000 employees. People run grocery stores, and what they're finding is if they use really good testing, testing whatever's available, if they use best medical practices, if they are hyper sensitive to disinfectants and social distancing in the workplace, that they can operate their businesses and yet keep their employees safe. And that's what we need to do, because if we don't, we're facing potentially 25% unemployment, even 30%, which I don't think we've ever seen. Even back to the Great Depression, we never saw unemployment rates that high.
There is another phase in the economic stimulus still to come. Why do you say that this next bill could be World War IV?
Well, just because you're seeing what Nancy Pelosi and Chuck Schumer are saying, the Democratic leaders of the Congress, saying they want Green New Deal, they want massive new government spending, another $2 trillion bill. In fact, Joe Biden said we might need 2 more $2 trillion spending bills. They want Medicaid for all or Medicare for all. They are using this as an opportunity to essentially enact the Bernie Sanders agenda. That, I'm here to tell you, that would be catastrophically bad for the economy to put in place these kinds of measures. So what most Republicans want to do is exactly the opposite. First of all, in fact, today I was talking on the phone with many members of Congress, and we all agreed, no more spending. We did the spending in the what phase was that? Phase 3. It's hard to keep track of what phase we're on. What we need to do now is cut taxes, reduce regulations. Here's another one. We need to provide a shield of liability insurance, kind of immunity for employers, so they can't get sued if they bring back their workers on the job and then they get sick. So those kinds of measures will be pro-growth, will get the economy back on the track. And look, I'm an optimist. I think if we do the right things and take these steps, by the way, we also need a payroll tax reduction for the rest of the year to give workers a raise in their paycheck for working, and employers reduce payroll costs so they have an incentive to hire workers back. If we do those kinds of things, I really think by late summer, early fall, we could be in a situation where we're starting to really dig out of this hole. And perhaps by the start of 2021, we're back in some good financial shape.
Okay, Stephen, that is the hope for us all. Stephen Moore with the Heritage Foundation, thank you so much for your time.
Thanks for having me. Have a great night.
The president loses his press secretary. That and more when we return with our Faith Nation political panel.
Hey, if you're tired and exhausted all day, you can't think clearly, and you really just need a cup or even a pot of coffee to get through your day, then join me, Dr. Josh Axe, for this new series where I'm going to teach you how to transform your diet and use essential oils and supplements to get a better night's sleep.
Wake up to your best life. Call 1-800-700-7000 to get your free DVD or booklet of Protect Your Sleep today.
It's about the competition.
I kind of put that pressure on myself, and I think people had expectations.
It's about overcoming.
We use this phrase all the time, keep chopping, keep practicing hard.
It's about going the distance.
You know, I think as a father, it's my job, to lead. Just be the best husband and father I can be.
Watch Going the Distance with Sean Brown Saturday night at 7:30 on the CBN News Channel.
Orphans Promise is committed to loving and serving at-risk children, to helping keep families together, and to creating opportunities for strong and sustainable communities around the world. We're working in over 60 countries around the world, and with your help, we can do even more. There's an old African proverb I love that says, if you want to run fast, run alone. But if you want to run far, run together. At Orphans Promise, we want to run far so we can touch the lives of as many orphaned and vulnerable children as possible. But we don't want to go alone. We're out to change the world, one child, one family, one community at a time. Will you join us?
Welcome back. Wisconsin is holding presidential primary voting today despite attempts to delay it by the governor. The state Supreme Court ruled Monday night to move forward with today's in-person voting, making it the only state to hold an April primary in the middle of the national effort to combat the pandemic. Wisconsin has 84 Democratic delegates up for grabs. Currently, Joe Biden leads the delegate race. He's racked up 1,217. Senator Bernie Sanders has 914, and a total of 1,999 delegates is needed to secure the Democratic nomination. Well, joining us now is our chief political analyst, David Brody. David, great to see you.
Good to see you, John. It's been a while.
Well, it has been a while. Well, between the governor's call for the special session to the last-minute ruling there by the state Supreme Court, this has gone through so many twists and turns, now with voters going to the polls, even with a statewide stay-at-home order. Was that a dangerous call?
Well, sure, but here's the thing, John. It could be dangerous on the health perspective, and we all know that for sure. It could also be dangerous if they didn't overturn it from a constitutional perspective, because no one, the Republicans and even the Democrat governor, thought it was constitutional to do it in the first place. So you have danger on both ends. Bottom line is there were supposed to be a lot of polling precincts open. Many of them are not open. This would be very interesting to watch the results come in from Wisconsin this evening.
David, whether a good idea or not, the Wisconsin primary results could be the final death knell for Bernie Sanders, could it not?
Well, sure. But of course, we've said that with Bernie time and time again. And now it's become Bernie who? Because of the coronavirus, he has not only taken a backseat, he's pretty much on the back bench. I mean, look, his campaign has been done for a long time, even though he's still in the race. Look, he's still in the race to make sure that Joe Biden implements or at least starts to give some of Bernie Sanders' plans some street cred and some oxygen and some lift as they move towards this, whatever it is, a virtual convention in August at this point. That's the reason Bernie's in the race. But effectively, this race is over, and it'll be Biden versus Trump in the fall.
All right, David, switching gears today, the White House announced Stephanie Grisham returns to First Lady Melania Trump as her chief of staff, and Trump 2020 campaign spokesperson Kayleigh McEnany will now replace her as White House press secretary. David, why the change and why now, especially amid this pandemic?
Right. Well, it starts with Mark Meadows, the new chief of staff. He wanted people that he was comfortable with around him. He's going to bring in Kayleigh McEnany, who he knows well. He's also going to bring in Alyssa Farah, who used to work in the vice president's office, but also worked with Congressman Meadows at the House Freedom Caucus. And also he has Ben Williamson around him as well, who'll also be a communication advisor. So in essence, it's kind of a package deal. They're all coming in. Stephanie Grisham going over to the White House, or excuse me, to the First Lady's office as chief of staff. But look, Kayleigh McEnany, look, she's really, really impressive on television. Don't take my word for it, just Donald Trump. He likes her, and honestly, that's all that matters. Meadows likes her too. So you can see Kayleigh McEnany not necessarily reviving the White House briefings, but really doing pretty much the bulldog on television and really defending this president.
David, if you can, in about 30 seconds, we know that the White House and Congress appear to agree on one thing, and that's the need for another stimulus package. What do you think that would look like, and how difficult will it be for Congress and the president to reach a deal?
Well, I think the degree of difficulty will not be that hard, actually. They're going to have to do it. Anytime politicians want to spend money, it's usually not that hard, and especially during a crisis. And I don't think politics, I heard Stephen Moore earlier, politics has been an issue with the Democrats. They want to inject a lot of that Green New Deal and all that other stuff in there. I don't think it's going to happen in this phase 4. We get down the road a little bit more, watch out. But Nancy Pelosi and Chuck Schumer pretty much signaled we just want to extend a lot of what they and the Republicans did in phase 3.
All right. David Brody, always appreciate your insight. Thanks for being with us.
Thanks, John. Good to see you again.
Daddy?
Yeah, buddy?
How many nickels are in a dollar?
There are 20 nickels in a dollar.
How do birds fly? Does milk really make my bones stronger?
Yeah.
Daddy, when we die, will we go to heaven?
Do you have the answer to life's biggest question? Call the 700 Club. We'll help you find answers to the important questions life brings your way.
Watch breaking news, in-depth exclusive stories and programs from health to entertainment you won't find anywhere else. The CBN News Channel, a perspective you can trust. Enjoy credible news reporting from around the world. Discover inspiring programs and stories of hope, all in one place from a Christian perspective. The CBN News Channel, a perspective you can trust. To watch the CBN News Channel, download the app or visit cbnnewschannel.com.
Hello, I'm Dr. David Perlmutter, board-certified neurologist and #1 New York Times best-selling author. Wouldn't it be great to boost your energy, eliminate brain fog, and even reverse brain disease? Well, you can, and I'm going to show you how, along with some of the world's most well-respected brain experts in this DVD, Protect Your Brain.
Get Protect Your Brain, a free DVD only from the Christian Broadcasting Network, featuring experts on the cutting edge of neuroscience and brain health.
No matter how many times you've failed in the past, you really can do this.
In Protect Your Brain, you'll discover simple strategies to keep your brain young and healthy. Improve your memory. Discover the gut-brain connection. In Protect Your Brain. Get your free copy at cbn.com or call 1-800-700-7000.
If you want to improve the quality of your life, get the DVD Protect Your Brain and get it today.
Well, as you know, this Sunday is Easter Sunday. Joining me now to discuss ways to commemorate Holy Week in these unprecedented times is Christian prophetic leader Dr. Joshua Fowler. Joshua, you've organized what's called a global communion service this Wednesday. Why do you feel it's important for people to come together on the same day at the same time?
Well, in a time like this where people are hopeless and people are in fear, I believe we need to come together as the body of Christ and release the hope that we can only find through Jesus. And I believe, even as the Lord spoke to me, he said to gather my people, gather my prophets, and as we gather together, we return and remember him at his table, that there would be a turning of the tide as we turn to him. So I believe like never before, the body of Christ needs to come in a spirit of humility and recognize that Jesus is the only one that can bring the cure and bring healing to the land.
So Joshua, tell me a little bit about who's taking part and what this service will look like.
Well, when the Lord spoke to me about this, I wanted to make sure that this was the timing of the Lord and that this is what he desired. So I reached out to a few friends. We have leaders like Bishop Joseph Garlington, Bishop Harry Jackson. We have Pastor Samuel Rodriguez. We have Cindy Jacobs, Sean Bowles, Dutch Sheets, Patricia King, Kim Jones, or she's known as Real Talk Kim. We have Tom and Jane Hammond, and the list goes on of great leaders from all around the world, from Africa. We have people come on from Papua New Guinea, from New Zealand, from Asia, all over the world, gathering together simultaneously, taking communion and remembering the Lord.
So how does this work on a practical level? Are people just taking whatever they have at home for the folks who want to participate?
Yes. You know, there are some people that might be able to have grape juice, or they might be able to have the bread. And so I've just encouraged people just to get what you can that would symbolize the body of the Lord and represent the cup of the Lord. And let's come together and let's see as we return to him. Here's what he said to me. He said, these are the days of the great return. He said, as my people return to me and remember me, there's going to be a turning of the tide, not only for COVID-19, but a turning of the tide for the nations, for global harvest. The nations are going to turn and seek the Lord as we return and remember him.
Joshua, finally, for people who want to learn more about it or maybe join the Global Communion Service, where can they find out details?
You can find out more at our website at awaketheworld.org, or you can follow us on Facebook at facebook.com/Dr. Joshua Fowler, as well as on Instagram at The Joshua Fowler. We want to see you come, your families come, your children gather around the table of the Lord with us, and let's remember the Lord, and I believe we're going to see the turning of the tide.
Dr. Joshua Fowler, thank you so much for joining us, and we wish you and the event much success.
Thank you, sir.
I am Region's first ROTC graduate student.
Meet the pastors who are preaching the gospel in a fresh, fearless way. I'm Roberto Torres-Cedillo. Join me each week for Next Gen Voices. And watch God transform a generation.
How'd you like to get a redo on your health, on your body, on your arteries, so you could have the energy you had 20 years ago? The great news is you can. I'm Dr. Mike Roizen, chair of the Wellness Institute at the Cleveland Clinic. I've written 4 New York Times bestsellers. But even better than having to read all that, you can listen to this DVD and watch it. Protect your heart? Yes, you can. Here's how.
Go to CBN.com or call 1-800-700-7000 for your free copy of Protect Your Heart. Let the medical experts show you their new discoveries on how to avoid heart disease and even reverse it. Easy steps to uncover the hidden dangers in your medicine cabinet, reduce stress, and get a complete do-over for your health. Call 1-800-700-7000. That's 1-800-700-7000. Or go to CBN.com to claim your free copy of Protect Your Heart.
And thanks so much for watching. Have a great night.